Imagine being born with just one major blood vessel coming out of your heart instead of two. Normally, the heart has two major vessels: the aorta, which carries blood to the body, and the pulmonary artery, which carries blood to the lungs. But with a rare congenital heart defect called Truncus Arteriosus, these two vessels don't separate properly during development. So what happens to the baby's blood flow, and how is this condition treated? Let's find out. Welcome back to Heart Lifelines. Today, we're talking about Truncus Arteriosus, a rare congenital heart defect that develops before birth. We'll explain what it is, how it affects circulation, the symptoms it can cause, how doctors diagnose it, and how treatment can help restore more normal blood flow. What is Truncus Arteriosus? Normally, the heart develops so that two separate major blood vessels leave the heart. The aorta carries oxygen-rich blood from the left side of the heart to the body. The pulmonary artery carries oxygen-poor blood from the right side of the heart to the lungs. In Truncus Arteriosus, these vessels don't completely separate during development. Instead, one large blood vessel, called the truncus, comes out of the heart. There's usually also a large opening between the heart's lower chambers called a ventricular septal defect, or VSD. Because of these abnormalities, oxygen-rich and oxygen-poor blood can mix. The single vessel then carries blood toward both the lungs and the rest of the body. This creates an abnormal circulation pattern that can place extra stress on the heart and lungs. Why is it a problem? To understand why Truncus Arteriosus can be serious, think about what normally happens. The right side of the heart sends oxygen-poor blood to the lungs. The left side sends oxygen-rich blood to the body. These pathways are normally separated. With Truncus Arteriosus, blood can mix because of the VSD, and the single vessel supplies both the lungs and body. This can cause too much blood flow to the lungs. The heart may have to work harder, and the lungs can become exposed to higher blood pressure and increased blood flow. Without treatment, these changes can become increasingly harmful. That's why Truncus Arteriosus generally requires specialized medical care early in life. Symptoms: babies with Truncus Arteriosus often develop symptoms early in life. Possible signs include bluish or grayish skin, caused by abnormal oxygen levels, rapid or difficult breathing, fast heartbeat, difficulty feeding, poor weight gain, or unusual tiredness, sweating during feeding. Some babies may develop signs of heart failure, such as rapid breathing, poor feeding, or swelling. The severity can vary, but symptoms usually become noticeable during infancy. If a newborn develops significant breathing difficulties, blue or gray skin, or difficulty feeding, urgent medical evaluation is important. How is it diagnosed? Doctors can often identify Truncus Arteriosus using an echocardiogram. An echocardiogram uses sound waves to create moving images of the heart. It can show the single major blood vessel, the VSD, the heart chambers, and how blood is moving through the heart. Sometimes the condition can even be detected before birth during a fetal ultrasound. After birth, doctors may also use tests such as a chest X-ray, ECG, oxygen measurements, CT, or cardiac MRI depending on the baby's needs. These tests help doctors understand the baby's individual heart anatomy and plan treatment. How is it treated? Unlike some very mild congenital heart defects, Truncus Arteriosus generally requires surgical repair. The goal is to separate the blood flow going to the lungs from the blood flow going to the body. During surgery, doctors close the VSD so the left ventricle can send blood toward the body's circulation. They also create a separate pathway from the right ventricle to the pulmonary arteries so blood can travel to the lungs. The single large vessel is then used as the new pathway for blood traveling to the body. Because the repaired heart grows as the child grows, the connection leading to the lungs may need additional procedures or replacement later in life. That's why lifelong follow-up with a congenital cardiology team is important. Living with Truncus Arteriosus. With appropriate treatment and ongoing medical care, many children with Truncus Arteriosus can grow and develop. However, they usually need lifelong follow-up because repaired valves and blood vessels can develop problems over time. Regular cardiology visits allow doctors to monitor heart function and identify complications early. Truncus arteriosus is rare, but understanding how it changes blood flow helps us understand just how amazing and complex the developing heart really is. Thank you for watching Heart Lifelines. We'll see you in the next video.